Hey everybody, Tim Albrecht here, and thank you for listening to the YFP podcast, where each week we strive to inspire and encourage you on your path towards achieving financial freedom. This week I welcome to the show Josh Workman, a certified insurance counselor, insurance agent, and Medicare specialist. Aside from helping individuals who are new to Medicare, he also works with professionals such as care facility coordinators, doctors, and pharmacists as they assist their patients with Medicare plan decisions. We tap into his Medicare experience to discuss 5 key considerations for evaluating Medicare benefit options. You'll find this episode insightful and helpful whether you are evaluating benefits for yourself or helping patients or other family members navigate this process. All right, let's hear from today's sponsor, the American Pharmacists Association, and then we'll jump into my interview with Josh Workman. Today's episode of the Your Financial Pharmacist podcast is brought to you by the American Pharmacists Association. APHA has partnered with Your Financial Pharmacist to deliver personalized financial education benefits for APHA members. Throughout the year, APHA will be hosting a number of exclusive webinars covering topics like student loan debt payoff strategies, home buying, investing, insurance needs, and much more. Join APHA now to gain premier access to these educational resources and to receive discounts on YFP products and services. You can join APHA at a 25% discount by visiting pharmacist.com/join and using the coupon code YFP. Again, that's pharmacist.com/join and using the coupon code YFP. Josh, welcome to the show.
Thanks for having me, Tim.
Well, this is a treat. You and I have known each other for a long time. When Jess and I lived up in Northeast Ohio, our families got to know each other well. And I've always appreciated the work that you've done on the Medicare side. And it's taken us over 300 episodes, but I'm excited to finally bring this together to be able to tap into your Medicare experiences and knowledge. So thank you so much for coming on.
Yeah, thanks again for having me, Tim.
Josh, as we were planning for this episode, and here we are in the month of October, we're talking about all different aspects related to the health insurance part of the financial plan. And we realized that Medicare really isn't a topic that we've talked really much about, maybe not even if all, but it's such an important part of the financial plan for those that are making that transition into retirement. And as we were planning for this episode, we were thinking about a few different groups that may find value in this, right? So of course, there's the individuals listening that are getting ready to make that Medicare decision for themselves and making sure that they're optimizing that benefit selection. But perhaps even a bigger group would be, hey, I've got aging parents that are going through this phase, or I work at a pharmacy and often I have patients that come and looking for help in terms of Medicare selection and what are some of the things that I should be thinking about. So I know, Josh, in your work as well, you consult with individuals that are going through selection, but also work with other providers and facilities as well. Is that correct?
Yeah, that's correct. So working with individuals or maybe in a group setting, like a seminar setting, is a lot of what I do. But then, working with pharmacists, working with doctors, working with assisted living facilities, all those type of professionals have questions, and I'm able to help their patients as well.
All right, well, let's start with some of the basics of Medicare, Josh. Pharmacists get really a slim amount of this in pharmacy school. I remember we talked about, health insurance at large. We talked about the different parts of Medicare. It's been 15 years for me, perhaps, more for others that are listening as well. So let's start with some of the basics, Medicare 101, parts A through D. Just break down for us what those different parts cover.
Yeah, sure. So there's 2 parts to what's referred to as original Medicare. That's part A, like Adam, part B, like boy. So A would be hospital benefits. So you'd use your Part A coverage, for example, if you were in the hospital staying overnight for a surgery, let's say. Part B, like boy, that's going to be medical benefits. And think of that as more outpatient related things, specifically like just going to the doctor, seeing a specialist, an outpatient surgery, those kinds of things. But then there's a couple other parts as well. Medicare Part D, like David, or I like to think of it as D for drugs. That's the easy way to remember that one. That's going to be the prescription drug coverage. Part C is another way of saying Medicare Advantage. So we'll get into this, I believe, in a little bit, but that would be Part C, which kind of combines A, B, and D benefits into one plan.
Awesome. And timeline for coverage. This is something that I remember learning about this and just having the takeaway of like, this is important. You don't want to mess up in terms of when you're selecting coverage, making sure you're not missing a deadline. So what is the timeline for selecting coverage?
Yep. So there's going to be three main election periods, if you want to think of them that way. Three times when you will be signing up for your plan, making decisions on your plan. And I will say there's a lot of narrative out there that makes this a little scarier than it needs to be. It's not that intimidating. But the first one is what's called your initial election period. So this is when folks are turning 65, they're new to Medicare. Another thing when someone could be using their initial election period is if they're been on Social Security disability for
Mm.
24 months, or if they develop end stage renal disease or ALS, that's another
Hmm.
time prior to age 65 they can go on Medicare. But let's use the turning 65 example, as that's the most common. It's a 7-month window. It starts 3 months prior to your birth month, runs the month of your birth, and then 3 months after.
Mm.
So
Okay.
7-month window when you can sign up. Most folks will use the 3 months prior and then start their benefits the month of their birth. That's
Hmm.
most common.
So that is a pretty. I didn't actually realize it was that long in terms of the 7 months. So
Mhm.
the 3 months prior, the month of your birthday, and then the 3 months after. And then the other piece I'm thinking about here would be the transition or change, right? So I had initial coverage I selected. Here we're using the example of 65, but I'm looking at other options in the future in terms of renewals. And how does that work timeline wise?
Yeah, great question. So that would be what's referred to as the annual election period or annual enrollment. And
Okay.
that is a window of opportunity towards the end of the year, getting into it now. So October 15th through December 7th are the specific dates. And that's for folks who, yeah, let's say, for example, they're 67, they've been on Medicare for a couple of years now, but they want to reevaluate and see if the plan that they're on now is going to be the best one for
Mm.
the coming year. They can evaluate that during the weeks again of October 15th through December 7th. And then their change, if they do make a plan change, it would start taking effect on January 1st of the following year.
Okay. So those are the two main ones I've heard you mention so far. So that initial election and then the annual enrollment process. Anything else important to remember around the timeline for selecting coverage?
Yeah, so there could be a third election period. Just think of them as special election periods. And we do run into these. I do run into them every now and then. But if someone moves, for example, moves out of state, maybe, or it could even be a move to a different county within the same state, they would
Hmm.
qualify for a special election period to make a change. If someone gains or loses Medicaid eligibility, we recently saw a lot of that with the COVID benefits that were extended for folks on Medicaid. They basically couldn't lose their Medicaid eligibility, but that stopped. I believe it was in April of this year.
Hmm.
That qualifies for a special election period to make a change. Or if there's other things too, like you have a parent who moves into an institution, for lack of a better word, where they're
Hmm.
moving into like a long-term care facility or a nursing home, that would also qualify as a special election period to make a change outside of annual enrollment,
Hmm.
October 15th through December 7th.
Awesome. So with that background information, let's spend most of our time here talking about evaluating benefit options, what to look for, what to consider. And before we get into five main areas that you've seen, five big differences based on your experiences, I think it's important that we differentiate, at least at a high level, Medicare Advantage and Medicare Supplement plans. Because when we talk about some of these areas here in just a moment, we're going to be referring to both of those and the different sides to consider between them. So define those further for us.
Yeah, so generally speaking, you have two main options for coverage when you go on to Medicare. And I should say this is what most folks do. Most folks will either go with a Medicare Advantage plan or a Medicare supplement. Medicare Advantage is much more heavily advertised. Sometimes folks think that's the only option they have, but they technically don't. Supplements are an option as well. But there's going to be five major differences between those two plans that can really impact how you
Hmm.
receive your care, what you're going to pay out of pocket when you use your insurance, how you get your drug coverage, if it includes perks like dental, vision, hearing, all those kinds of things. So yeah, there are some pretty major differences between those. And that's what I spend most of my time with on my clients who are new to Medicare so they can make an informed decision on what's best for them.
Yeah, I remember, Josh, you shared with me as we were preparing for this episode the worksheet that you have of kind of the two sides of the street, right? Choosing a
Yeah.
plan, Advantage versus Supplement, and kind of going through these, which I really like because I think this can become very overwhelming, either as an individual choosing coverage, helping a family member, helping a patient, especially when so often, as you mentioned, especially on the Advantage plan side, there's just a lot of advertising, right? That's behind
Mhm.
this, the mailings, the commercials, et cetera. And so really being able to take a step back and say, okay, what are the options? And how can we objectively compare these? And what do we need? What do we not need? And make an informed decision, I think is so important, not only financially, but also just have the peace of mind and being able to navigate some of the nuances involved here. So let's start with those five big differences. Number one, Josh, is Part D in terms of how one receives Part D insurance coverage. Tell us more there.
Yeah, so it's important to know a lot of people sometimes make an assumption that original Medicare, what we talked about before, Part A and Part B, that includes prescription drug coverage. It actually does not. So the only way you can get Part D is through an insurance company. Now, how it would work on either side of the street, yeah, is the way I like to describe
Mm-hmm.
it. If you go with a Medicare Advantage plan, most of the time those are going to include prescription drug coverage at no additional cost. If you go with the Medicare Supplement plan, however, it does not include prescription drug coverage or Part D. You have to buy that separately. So Advantage, it's
Mm.
included. Supplement, it's not included. You have to pick it up separately.
And number two, it relates to the network here. So we're thinking of options for providers, access to hospitals, something that folks are familiar with from other experiences with health insurance. But what are some of the factors to consider here as it relates to network coverage and the two sides of the street?
So Medicare Advantage plans are going to have a network, meaning there's a list of specific doctors, hospital systems, specialists that you need to stay within in order to have coverage or to pay the least amount possible.
Mm-hmm.
Medicare supplements, one of the big benefits of them is they do not have a network of any kind. So you can literally go to any provider in the country, in the whole United States, that takes original Medicare and they have to accept your supplement. So it doesn't
Mm.
matter what insurance company you have. You could be in the Northeast Ohio area like we are and have an insurance company that's local here and receive care in California, and they've never heard of your local company, but they have to take it because it's a Medicare supplement.
Mm-hmm. Mm-hmm. So that network piece, obviously, very very important to folks. The third area, which I'm sure is the one we're often focused on, is the cost side of it, the medical bills or the cost sharing. Ultimately, what we have to pay out of pocket when using insurance. So, what are some of the key differences here between the Advantage and the Supplement?
With a Medicare Advantage plan, you will have medical bills along the way as you use your insurance, or just you could say if you use your insurance. By medical bills, I'm referring to deductibles, co-pays, and co-insurance. So you may have a deductible. Honestly, most plans I offer, Tim, don't have a deductible folks have to reach, but they could.
Mm-hmm.
A copay, you know how that works. Most likely you pay
Mm-hmm.
$25 to your primary care, 40 to a specialist, those kinds of things. And then co-insurance is a percentage, right? So you may have to pay 20% for durable medical equipment or 20% for chemo and radiation.
Mm-hmm.
The nice thing about Advantage plans is that they do put a limit on what your medical bills can be. And most folks have this with your current insurance, even if you're not on Medicare, called an annual maximum out of pocket
Mm-hmm.
expense. So all of your medical bills for the year can't exceed your plan's annual maximum, but know that, again, you will have them along the way, medical bills, that is. Whereas Medicare supplements, they don't really have any medical bills that you're going to have to worry about. Okay. Really, the biggest medical bill for the most popular supplement that I write out of my office is the Part B, like boy, deductible.
Mm-hmm.
Currently here for 2023, it's $226. So you pay that for any Part B service. Once that's paid, though, Tim, the medical bills are done for the rest of the year. So
Wow.
that $226 deductible is your medical bill, and it's also your annual maximum if you want to think about it that way.
Okay. So very naive on this topic, Josh, but as you're just describing the differences, and obviously, when you talk about the supplement plan and the lower amount, what I seem to hear is kind of, not insignificant, but a much lower amount on the deductible. less potentially out of pocket versus when you reference the Advantage plans,
Mhm.
more out of pocket. What we tend to think of from our experiences probably now for many of us with insurance. So is it fair to say that cost wise monthly premiums, you typically see a vast difference between these two because of that, or is that it depends?
No, you're right. There's a difference in cost. So that would be the fourth big difference
Yeah.
here between these two. As I'm sure listeners are putting together, if you have to pay medical bills, if you have a network, well, you're probably going to be paying less than for your insurance because
Hmm.
you're kind of subjecting yourselves to these medical bills and to this network. So Medicare Advantage is going to be your less expensive route to take. It could even be, and folks may have seen this advertised. You could even see that these Medicare Advantage plans are $0 per month. Okay, those are actually some of the most popular Advantage plans that
Interesting.
my
Hmm.
some of my clients will choose is the $0 premium plan. Okay. Now, with supplements, though, these are going to have a monthly cost. There aren't any $0 Medicare supplements.
Hmm.
So, this currently, I mean, it all really depends on the area that you live in. I just work here in the state of Ohio, but here in Ohio, a good rule of thumb for a turning 65 male for a Medicare supplement, depending on the plan letter that's chosen, is probably going to be somewhere between 130 to $150 a month
Okay.
for a Medicare supplement. Female would be a little bit lower, and again, that's a pretty rough
Yeah.
estimate, Tim, just depending on the service area that you're in.
Yeah, it's really helpful though, Josh. I'm thinking about how this integrates back with the financial plan. And, it's taking me back to episode 275. Tim and I talked about how to build a retirement paycheck, right? So we've been accumulating funds, hopefully for a majority of our careers. And now we have to be able to replace what was coming from our income through the different retirement vehicles that we've built, right? 401ks, IRAs, maybe we have some HSA funds that could come into play here, as well. And this is important, right? Because if you're in, the plans that you were just referencing on the supplement side, where let's say you've got a monthly premium of $150 a month, and then you know what the deductible is going to be, like we can start to build those numbers into the monthly paycheck that we're going to be receiving during retirement, essentially paying ourselves. Or if we're on an Advantage plan, and let's just say there's an Advantage plan with the example you gave where there's a $0 premium, but we know what the out of pocket max or limit is, like, okay, we can be planning for that, right? Or planning for some of the other expected expenses from cost sharing of the healthcare. So you can really start to see how an understanding of the options and the plans and what the impact could be annually as well as monthly when you talk about something like the monthly premium could build into the financial plan, build into building that retirement paycheck as we make that transition into that phase.
Hmm. Yeah, exactly.
All right. Number five, Josh, this is one that I didn't think about that was really interesting when you were talking about this in our preparation for the show, was some of the variances between the plans when it comes to things like dental, vision, hearing, or the extras. Tell us more here.
When it comes to dental, vision, and hearing, this is becoming a much bigger issue, I would say, than it used to be. I've been doing this for several years now, and back when I started, folks weren't that concerned about dental, vision, hearing. However, advertisements on TV, the mail that folks are getting that are turning 65 heavily focuses on this
Hmm.
side of things. Medicare Advantage plans are going to include dental, vision, and hearing benefits, as well as other things too, like over the counter items allowances that the plans give people several dollars a month that they, or a quarter rather, that they can use to buy Tylenol or Advil or band-aids and toothpaste, that kind of stuff.
Hmm. Hmm.
So Advantage plans are going to include those kinds of things. And again, it's usually at no additional cost. Even a $0 plan would include these things. Whereas Medicare supplements do not include any of these kinds of things. But you can buy them separately, just like you buy the Part D separately. You can pick up dental, vision, hearing benefits at an additional cost if you'd like them.
Josh, before we wrap up by talking about some of the common mistakes that you're seeing folks making when it comes to evaluating benefit options and selecting a policy, summarize here for us the 5 points that we just talked about as, again, individuals may either be choosing their own policy, working with a family member, or working with patients that they can take away this information.
Yeah, so the easy way that I like to describe it is this. If you go with a Medicare Advantage plan, this is going to be your less expensive route to take. It's going to include Medicare Part D. It's going to include dental, vision, hearing. However, you are going to have a network and you are going to have medical bills along the way as you use it. Medicare supplements are your more expensive route to take. They don't include drug coverage. They don't include dental, vision, hearing, although you can buy them separately if you'd like. However, you don't have the medical bills and you don't have the network to be concerned with. So if you're a pharmacist out there and you're trying to quickly explain this to a patient, maybe just go about it that way. Medicare
Mm.
Advantage is less expensive. There's a network and there's medical bills. Supplement is more expensive, but it doesn't have a network and it doesn't have medical bills.
Great summary, Josh. I'm curious, like rough numbers, what do you see as like a distribution between these two buckets as you work with those going into Medicare enrollment?
Yeah, that is a great question. That's one that's become very common as my clients are sitting down trying to make a decision on what they want to go with. I'm finding now, Tim, and it didn't used to be this way, that it is about a 60-40 split. About 60% are going the Advantage plan side and about
Mm.
40% are going the supplement side. And when I first started, it was probably 70-30 the other way, more heavily
Interesting.
weighted on the supplement. So I think one of the big reasons for this is the marketing. It's just Advantage plans are much more
Mm.
heavily marketed to people who are new to Medicare. And like I said before, a lot of people think that they are the only option. And not that they're a bad option, but again, folks are just having much more education, getting much more education about Advantage plans than they are supplements.
Let's talk about that marketing because I think that's one of, maybe a little bit too harsh to call it a mistake, but I think the influence of the marketing can be real. I've seen many of these commercials, Josh. I think I know the ones you're referring to, and just the impact that whether it's mail marketing, TV, radio, a combination of can have in swaying someone in one direction or another. So tell us more about that, and even some of the other common mistakes you may see folks making when they're going through the selection process.
Yeah, so those commercials are becoming very popular. So we're talking about like the Joe Namath commercials, guys, that you
Hmm.
can't help but see, especially getting here into the fall, into annual enrollment. Those commercials, the mistakes I see people making is buying a plan based off of what they're seeing just on those commercials alone.
Hmm.
So if you actually pay attention to one of them, they are referencing primarily the perks of the plans. So the dental, vision, hearing benefits. They may even say things like call and check your zip code because you could get a plan where you don't have to pay for your Medicare premium at all. The plan will pay for it for you. And in my opinion, those aren't the only things you should factor in when you're buying health insurance.
Hmm.
You should factor in other things too, like does your doctor take the plan? Like that's a pretty big one. Yeah, you might have a nice dental benefit, but when you need to go to your primary care physician and they say, "No, we don't take this," how valuable is that dental benefit now?
Hmm.
Other things folks don't necessarily consider, especially on, and we can get into this more if you'd like, but these relatively new to the game Part B give back plans that pay
Mm.
some or all of your Medicare premium. Well, you got to think from an insurance company's perspective. If they're willing to pay your Medicare premium for you, what do you think that's going to say about the benefits they're going to
Right.
provide in the plan?
Yeah.
It primarily translates to higher medical bills to you.
Hmm.
And these are just things that I feel like are important for people to consider. That you're buying a health insurance plan, you want it to be solid when you need it. You don't necessarily want to buy a plan because it gives you $100 every quarter and over the counter
Yeah.
items
Yeah.
limit. So those are some of the mistakes I see people making. They buy a plan based off of perks, not
Hmm.
necessarily on the day-to-day usage of the plan that could be more important.
Yeah, which is it's a different form of marketing, right? It's not necessarily a commercial, but it's a different form of marketing to hook someone into a policy. So that's a good call out. I think both of those, Josh, to me highlight the value. And you showed me that worksheet, that side by side worksheet of, hey, we're looking at supplement plans, we're looking at advantage plans, we're applying somebody's personal situation. You're sitting down with them one on one, kind of talking through the benefits and the options. Like that really brings to life to me the value that an agent, especially someone in specialized in Medicare, such as yourself, can be helping, whether it's the person directly that's selecting the benefits, whether it's family members that are involved, or for our pharmacist community, again, especially those working in community practice, I know these questions come up all the time in terms of, hey, I'm a patient. I go to the pharmacy. I ask my pharmacist, about the policy or what should I be thinking. And so my question here is, your work is obviously in Ohio. So if we have pharmacists in Northeast Ohio, shout out to Josh, get connected with him for sure as well. But much of our listeners may be across the country. And so words that you would have to share in terms of what are some things that folks can look for in trying to develop a relationship with an agent as a pharmacist, or for those that are looking to select a policy for themselves or a family member and partnering with an agent in that way as well?
Yeah, so I'd say, first of all, from the pharmacist's perspective, I do work with several pharmacists and chains and whatnot. But I would say, from your perspective, don't feel like you need to be the expert on Medicare Part D specifically. You can say, "Hey, I don't know all the answers on what plan you should pick, but here's a guy you can call, or here's a girl you can call. They know, they do this for a living." The other thing too, guys, is it saves you time. I see, I'm in and out of pharmacies a lot. I see how busy you are,
Mm-hmm.
and I can imagine how stressful it is when you have 10 or 20 prescriptions you need to fill, and somebody asks to go into the private room and say, "Hey, what prescription drug plan is going to be best for me next year?"
Mm-hmm.
It can just take up a lot of time, I would imagine. So again, having an agent you can refer to handle those questions for you would save you a lot of time and alleviate that pressure of having to feel like an expert.
Yeah. Well, this was great, Josh. I really appreciate you coming on the show, sharing your expertise. As I mentioned at the beginning, it's been a long time in the making, covering a topic we haven't done much about before. So we will link in the show notes Josh's LinkedIn profile, email, if folks have questions, as well as a link to the insurance firm that he works with right now. So you can check all that information out in the show notes. And Josh, thanks so much again for coming on. Really appreciate it.
Yeah, thanks for having me, Tim. Go Bills.
That's so. This is the year. Let's do
It's
it.
the year, Tim. It's the year.
Awesome. Thanks, man.
Yep.
Before we wrap up today's episode of the Your Financial Pharmacist podcast, I want to again thank our sponsor, the American Pharmacists Association. APHA is every pharmacist ally advocating on your behalf for better working conditions, fair PBM practices, and more opportunities for pharmacists to provide care. Make sure to join a bolder APHA to gain premier access to financial educational resources and to receive discounts on YFP products and services. You can join APHA at a 25% discount by visiting pharmacist.com/join and using the coupon code YFP. Again, that's pharmacist.com/join using the coupon code YFP. As we conclude this week's podcast, an important reminder that the content on this show is provided to you for informational purposes only and is not intended to provide and should not be relied on for investment or any other advice. Information in the podcast and corresponding materials should not be construed as a solicitation or offer to buy or sell any investment or related financial products. We urge listeners to consult with a financial advisor with respect to any investment. Furthermore, the information contained in our archived newsletters, blog posts, and podcasts is not updated and may not be accurate at the time you listen to it on the podcast. Opinions and analyses expressed herein are solely those of your financial pharmacist unless otherwise noted and constitute judgments as of the dates published. Such information may contain forward-looking statements which are not intended to be guarantees of future events. Actual results could differ materially from those anticipated in the forward-looking statements. For more information, please visit yourfinancialpharmacist.com/disclaimer. Thank you again for your support of the Your Financial Pharmacist podcast. Have a great rest of your week.